is Dr. Scott Merkley, who is a gastroenterologist with the Lexington Clinic. Welcome.
Thank you. Thanks for having me.
Now, I started off gastrointestinal complaints. You know, people blow up, people have abdominal pain, they have heartburn, they have bleeding in their bowels. You know, we've talked a lot on this show about doing colonoscopies for screening for colon cancers, but there's sometimes that you might need a colonoscopy for other reasons.
Right, absolutely. And so, like you said, most people sort of equate having a colonoscopy with screening purposes, but there's a number of reasons why we do types of endoscopy outside of for screening purposes. This may have anything to do with gastrointestinal bleeding. This might be for an abnormal amount of weight loss, diarrhea symptoms that may persist. It may be for abdominal pain that's difficult to figure out. Sometimes patients get CT scans and there's an abnormality that we see, and so certainly an endoscopy might be ordered to evaluate that as well.
Now, you mentioned bleeding, but that can occur in different forms, and tell people what would be concerning.
You're right. It's a good question. So the gastrointestinal bleeding is probably one of a quite common reason some people are seen through the emergency department or even in an outpatient setting through a primary care doctor. Bleeding, as far as concerning signs that we might see, would be somebody who's having a large amount of what we see as what's called red blood per rectum, or we call hematochezia. Sometimes people will have bleeding that may present as a black or sticky type of stool. It's kind of how we define bleeding. We have bleeds that first we want to know, is it like an acute or an overt bleed? That means we see it. And that might be that red blood or that kind of black or sticky colored stool you might see, or even vomiting some blood, versus somebody who might have more of a chronic bleed, and these tend to be occult. And that might be the scenario where a patient gets a call from their doctor and says, you're a little bit anemic, let's get a stool test and see if there's microscopic blood in your stools. That might be more of you're more of a chronic bleed and a reason to need a colonoscopy. But as far as the upper GI bleeds, I mean, these can bleed anywhere from your esophagus that we might see, from your stomach, to the early part of your small bowel. We tend to define lower gastrointestinal bleeding from the lower part of your small bowel, your colon, and your rectum.
Okay, so if you have bleeding and colonoscopies indicate, what are some of the diagnoses that you might see other than colon cancer?
Right. And so it might be anything from in the stomach. We might see stomach ulcers. We may see ulcers in the early part of your small bowel. In the colon, we may see findings with inflammatory bowel disease. That can be Crohn's disease, ulcerative colitis. There are non-infectious types of conditions that we may see, or diverticular bleeding. Many people have diverticulosis, but they can also bleed, and it actually can bleed quite a bit. And we can have bleeding from hemorrhoids as well.
Okay, you mentioned inflammatory bowel. Is that pretty common, or?
Actually, we do see a fair amount of inflammatory bowel disease. This classically gets broken up into ulcerative colitis and Crohn's disease, and these are chronic inflammatory conditions of your colon, your small bowel, and can also involve the upper part of your mouth and your esophagus as well. They're a little bit different in their disease distribution and how they behave, but they're both conditions that can cause abdominal pain, weight loss, and gastrointestinal bleeding.
Okay, so let's say you've been through a colonoscopy for that's what's called a diagnostic colonoscopy, and then there's a screening colonoscopy. Briefly tell us who needs to be screened.
So it's a great question, because that's recently changed. Classically we said most individuals need to be screened at age 50. That was recently changed in 2018 by the American Cancer Society. They dropped that to the age of 45. This is based off observations and studies that show that we were finding polyps, which we look for what are called adenomas. And colon cancer follows this polyp through adenoma sort of pathway to become colon cancer. And what they found were that patients were presenting earlier age than what we typically saw before age 50 with polyps. And so we want to remove those early before we ever have any potential to develop colon cancer.
And you talk about endoscopies, so there are two types. There's colonoscopy and there's upper endoscopy. And depending on what you're looking for is depending on which test you would have.
That's right, absolutely. There could be a myriad of conditions with swallowing difficulties, heartburn, and types of evaluations where we can identify even hiatal hernias, Barrett's esophagus, which is a precancerous condition, and stomach infections with something called Helicobacter pylori or celiac disease would be common things we could see with an upper scope. Again, lower scopes being identified things like inflammatory bowel disease, large colon polyps, colon cancer, or infectious types of colitis that may be causing pain and weight loss and diarrhea.
That's great information. Thank you for coming in and sharing with us.
Yes, sir. Thank you for having me.
And if you have gastrointestinal complaints or bleeding, don't ignore them. Check with your doctor. We'll be right back.